We can all agree that America is a global leader of innovation, and the government should do everything it can. Being with us today, with this hearing, the focus on innovation and some of the biggest roadblocks. We can all agree that America is a global leader of innovation, and the government should do everything it can to foster an environment that promotes greater innovation and patient access to innovative care. Unfortunately, we have all seen the news about recent examples of government getting in the way. CMS restrictive coverage mandate for new promising Alzheimer's treatment, repealing the Trump admin rule with no replacement still, CMMI considering changes to cover for Part B drugs that receive FDA accelerated approval, USTR's TRIPS waiver of critical IP protection for COVID vaccine, and the so-called government negotiation of drug prices implemented under the Inflation Reduction Act. In fact, just last week, data was released on a third promising Alzheimer's drug showing it significantly slows the progression of the disease, but it'll still be a subject of current restrictive CMA mandates. The landscape has changed since June 2021. The Alham was approved by CMS refuses to consider the coverage, despite evidence showing they're very effective in treating Alzheimer's in its early stages. This is a progressive, and 6.7 million Americans living with it don't have time to wait on CMS to come to its senses. This delay means many things to a lot of the different patients, and it's been a big challenge. In fact, in April 26th, bipartisan attorney general across the 26 attorney generals across the country sent a letter to Secretary Buchanan and the administration on CMS to consider a requirement for covering these drugs, and I'm submitting this letter for the record today. As someone who has firsthand been devastated in terms of the impact in terms of Alzheimer's, my own father, and because I'm one of the oldest districts in the country, this issue is personal and important to me. In fact, in the effort to push CMS to do their job the right way, I introduced a bipartisan Merit Act earlier this year to require CMS to consider each new drug on its own rather than as a class. FDA approval, whether traditional or accelerated, is a full approval, and CMS should not be second-guessing the scientists at FDA who granted the approval in the first place. Additionally, as a former ranking member of the Trade Subcommittee, the TRIPS waiver for COVID vaccine is of particular concern to me, given it directly undermines the mission of the USTR to vigorously protect Americans' interests abroad, including protecting intellectual property rights. I have led multiple letters signed by my House colleagues opposing the TRIPS waiver because there is no reason to continue pursuing such a waiver. It will be only our adversaries to access critical IP that they have no other possession. The pandemic is over. The public health emergency ends tomorrow, and we have an abundance of vaccine doses that are available for people in the farthest reaches of the earth. Unfortunately, the physical infrastructure doesn't exist to get the doses to those people instead of giving away our IP to other countries. We should be helping to teach them how best to update their outdated infrastructure. If we continue down this path of working against innovators, we will start falling behind countries like China that are willing to do whatever they can to pass us by. Finally, I want to mention CMMI because despite having innovation in its name, it's one of the greatest barriers to actual innovation in healthcare. Since 2010, CMMI has released many demonstration projects, some of which were mandatory, but has not realized savings greater than the amount of the money Congress has spent on the agency. We all want Medicare and Medicaid to run efficiently, but it's time that Congress reasserts its control over these decisions and works to truly help promote American innovation. There is bipartisan interest in many of these topics we're going to talk about today, and we should find bipartisan solutions to them. I'm in the business, personally, of trying to get to yes with my colleagues, so I'd like to challenge my friends on the other side of the aisle to work with us on a way to unleash American innovation. We all want America to lead the world in medical innovation, and we want America to have access to the newest, best groundbreaking treatments as soon as possible. I hope we can leave this hearing today with a renewed sense of bipartisanship and willingness to work together on policies that protect and enhance innovation.